immense and sustained pressure from coronavirus. It always takes time for the gains we are seeing in the community to work their way through into the health service. And this week, we passed some very sobering milestones. The number of coronavirus patients in our hospitals exceeded double the peak we saw in the first wave. The number of people in critical care beds with coronavirus is almost the same as the total number of intensive care beds we would normally have available for everything that the NHS does right across Wales. And the NHS has had continually to increase capacity to respond to that demand. And every time that happens, it has a knock-on on the ability of the NHS to provide non-emergency services. And very sadly, this week we passed 5,000 deaths reported by the Office for National Statistics. I want to pause for a moment to remind us all that we are not here simply talking about numbers. These are people. They had friends. They had families and neighbours. They lived in communities. They worked in places of work, and they had life still to live in front of them. Our thoughts are with those people who cared deeply for them and the loss that they feel to this cruel virus. Last week I said that we would be working with major supermarkets and retailers to make sure that staff are safe and that we are safe whenever we go shopping, and that we would be strengthening protections in workplaces more generally. I want people to be able to go shopping knowing that all the measures that are needed are there in place to protect them from coronavirus. We have had a series of positive meetings this week with retailers. As a result, we will put into the law those measures which are currently set out in guidance. For example, all retailers will need to have signs visible to help people to keep their distance and to make their way safely around the store. They must have sanitizer available for hands and trolleys, and they will have to have systems in place to limit the number of people who can be in store at any one time. Now, many of our retailers are already operating at these high standards. What this does is to make it clear that that bar will be raised so that all places where people are able to shop meet those standards. I turn now to workplaces more generally. To help people feel confident about going to work if they cannot work from home, we will make it a legal requirement for all businesses with 5 or more employees to carry out a COVID risk assessment. All businesses that already have such an assessment will need to rerun it to take account of the new strain of the virus. Those risk assessments will include ventilation measures, social distancing, PPE and face covering, and making sure that the maximum number of people are supported to work from home. Risk assessments will have to be updated whenever circumstances change, including when the alert level changes. Staff and unions must be involved in the production of those risk assessments, and once they're completed, they must be made available to staff who work in that workplaces. And the purpose of all of this, strengthening the rules in retail and in workplaces, is to make sure that those settings too help to continue slowing the course of this awful virus. In the meantime, we are redoubling our enforcement efforts to make sure that the hard work of the many is not undermined by the recklessness of the few. I want to thank our police and local authorities who play such an important role in enforcing the restrictions right across Wales. On Monday, the Health Minister Vaughan Gething warned about a nasty scam involving vaccines, and sadly, There are too many fraudsters trying to gain money by deception out of this cruel illness. And if you think that you have been targeted, please tell somebody who you trust so that you can get the help that is available. And this afternoon, I particularly want older and vulnerable people to know that they do not need to allow anyone into their home unless they have agreed for that person to be there. Our lockdown rules allow work to be carried out in people's homes, but other than in an emergency, it is your choice about whether you want to let someone in, and you should never feel that you are pressurized to do so when you think that that is not safe. So this week we are beginning to see signs of improvement across most parts of Wales. But we know just how quickly the situation can change and how quickly cases of coronavirus can spread again if we let our guard down. Our nearest neighbour in the Republic of Ireland had some of the lowest rates in Europe at the start of December. Just 3 weeks later, the course of the pandemic there had moved dramatically, and today the Republic has the highest rates in the world. That is why it is so important that we all carry on following the basic rules we have learnt so well. Staying at home, working from home wherever possible, not mixing with other people beyond our own household or support bubble. Our path out of this pandemic does now lie in front of us. Everyone has to tread that path in a way which keeps ourselves, our loved ones, and our communities safe from this dreadful virus. Diolch yn fawr iawn I chi gyd. I'll take questions now as usual, and as usual as well, all the answers will be broadcast on our social media channels. I see that first this afternoon is Teleri Glyn-Jones of BBC Wales.
Iawn da, Prif Weinidog, os gawn ni'r atebion yma yn Gymraeg ac yn Saesneg, os gwelwch yn dda. You've announced changes to the laws on how retail works. Is it staff who will be expected to enforce some of these rules? And is it fair to ask them to do that, considering the abuse some of them have had when asking people to conform to the existing rules?
Well, it is the responsibility of owners and managers to make sure that the measures that will be placed in regulations are observed, and the things that I've set out this afternoon are all things that lie in the hands of management. Regular announcements over tannoys, markings on floors, notices that are up. All of those things are things that managers can make sure are in place. And to be completely clear, it is entirely unacceptable that retail staff who have done so much to help us all during this pandemic, going into work every day to make sure that there's food that we can put on the table. It is entirely unacceptable that those people should face abuse in the workplace. We work closely with the trades unions in reaching the conclusions that I've outlined this morning, and none of this is designed to put those people at any greater risk. So just I ddweud, popeth ni wedi cyhoeddi heddi, mae'n yn y dwylo y bobl sy'n reoli archfarchnadoedd a llefydd eraill. Mae'n yn y dwylo nhw I wneud popeth dwi wedi esbonio bore yma, ac i fod yn glir, mae'n hollol anferbyniol I bobl sy'n gweithio mor galed a sydd wedi rhoi gwasanaethau I ni gyd ledled a pandemic. Pan mae bobl yn bihafio fel ni wedi clywed fod yn gas yn fod yn anresymol, a ni wedi gweithio'n galed gyda'r undebau sy'n gynrychioli bobl yn y gweithle. A dwi'n siŵr, popeth dwi wedi ddweud heddi, mae'n mynd I warchod ni pan ni'n siopa, mae'n mynd I warchod bobl sy'n gweithio yn y cyd-destun na hefyd.
Diolch yn fawr iawn, ac yn ail felly, if supplies keep up with your plans for the milestones of rolling out the vaccines, and the cases continue to stabilise and this good progress we're seeing continues, how long can we reasonably expect lockdown to go on for? And what about schools in that question?
Thank you, Tilly. Well, we will review the current arrangements by the 29th of January. That's a 3-week cycle that we're committed to, and we will stay with that. If things over the next 2 weeks continue to head in the right direction, then the Cabinet will decide whether there is any headroom for us to begin the process of lessening the current level of restrictions that we all face. But I just remind everybody of the cautionary story that I relayed from the Republic of Ireland, going within 3 weeks from being the best to the worst position in the world. And at the moment, because of all the efforts that we have made and the early decision we made in relation to lockdown, things are improving. But we would have to be certain that that improvement is reliable, sustainable, in order for us to begin the journey of lifting the restrictions. We want to do that as soon as it is safe to do so, but it will have to be safe. And as far as schools are concerned, I chaired a meeting yesterday involving the local education authorities, teaching and other staff unions in schools and colleges and the Welsh Government. We committed to working together to put measures in place that will allow a return of greater numbers of our young people to face-to-face learning as quickly and as safely as that can be brought about. It was a constructive and useful meeting. There were practical things talked about there, and we will now be following them up together. We all want children to be back in the classroom, but we all want that to be done in a way that is safe for them and for the staff that work with them and support them. Thank you, Teleri, to Nick Powell.
Awn ni hwnna yn Gymraeg hefyd, os gwelwch yn dda, mae'n ddrwg gen i, sori.
Anghofio si, mae'n drwg da fi. So, jyst i ddweud, fel ni wedi dweud, ni'n ail-edrych ar y cyfyngiadau yma yng Nghymru bob tair wythnos, a ni'n mynd i wneud hynny cyn y 9 ar 20 o mis Ionawr. Os mae pethau yn dal i fynd yn well, bydd y Cabinet yn gallu weld os mae lle o gwbl da ni i ddechrau y proses o codi y cyfyngiadau sydd da ni a hyn o bryd. Ond bydd yn pwysig i bod yn siŵr bydd y patrwm ni'n weld heddi, bydd hwnna'n ganoladwy a ni'n gallu weld hwnna yn cario ymlaen ar ôl diwedd mis Ionawr. Yn y maes addysg, ges i cyfle cydeirio cyfarfod gyda'r undebau, gyda'r awdurdodau lleol ac gyda'r gweinidogion yn y llywodraeth yma. Pwrpas y cyfarfod oedd i edrych dy gilydd a pethau ymarferol ni'n gallu wneud i trial i tynnu fwy o'r pobl ifanc a plant nôl i'r ysgolion i cael addysg wyneb a wyneb, ond wrth cwrs i wneud mewn ffordd sy'n ddiogel i'r plant ac i'r athrawon a staff eraill. Oedd y cyfarfod yn adeiladol, a ni gyd yn eisiau weld fwy o blant nôl yn yr ysgol, a nawr ni'n mynd i cydweithio dy gilydd i paratoi a weld beth allwn ni wneud mewn ffordd ddiogel. Diolch yn fawr.
Diolch yn fawr iawn i chi.
Over to Nick Powell at ITV Wales.
Diolch. Could you explain the science behind this tightening of the requirements on supermarkets? How strong is the evidence that people going shopping is a significant cause of coronavirus transmission?
Well, Nick, there is significant evidence. You'll see it in there in the number of the technical advisory report cells. We get it through our TTP system as well, which talks to people who have been tested positive and traces with them where that may have taken place. And there's no doubt at all, and particularly when there are so few other places where people are able to meet, that there are risks that are run when people go to supermarkets. Now, as I said, the majority of supermarkets have worked very hard to make those places as safe as possible. But as I said last week, there was no doubt either from my postback, or people who contact me, that there is a feeling amongst the Welsh public that the visible signs of protection, which were there back in the spring of last year, when it was very obvious to you if you went to a supermarket that everything was being done, that some of those visible signs had been reduced. And I think it is very important in giving confidence to staff and to people who go shopping that that more visible sense that everything is being done to protect them is put back in its place. And I'm very confident that we will have, as we've seen this week from announcements by a number of leading supermarket chains, that they too will want to make sure that everybody who visits there knows that everything is being done that can be done to keep them safe.
Thank you. Community Pharmacy Wales say that COVID vaccine should be at least available everywhere that offers flu vaccinations, and they want immediate action on that. As they say, they could administer 6,000 vaccinations a day. Now, I know we've seen the pilot scheme start in Llŷn today, but a lot of them haven't even been contacted by their health boards. When is that going to happen?
Well, there's more than one way in which community pharmacists will be asked to play a part in the vaccination programme. We've started today, as you say, with a pharmacist on the Llŷn Peninsula. They will be offering vaccinations to 50 people in their own premises, and then they will be going out to deliver vaccinations themselves in care homes in the area. Many community pharmacies, as some people who have had their flu vaccination there, as I have over the years, will know, that the spaces that are available for vaccination are relatively small and where high volumes of people may be difficult to accommodate. In some of those cases, we will ask community pharmacists to go to our mass vaccination centres, where they will be able to deploy the skills and experience they have to get more vaccinations done than they would be able to in their own premises. Other community pharmacies have different sorts of premises and can cope with volumes. So that's the discussion we will be having with community pharmacy in Wales, making the very most of the skills and capacities that sector has, and as I say, in more than one way, because we may be able to make more effective use of some people's skills by the person going to a mass centre or helping with the care home programme than simply opening their own premises for vaccination. But some premises, many premises, I've no doubt, will actually offer it on site themselves. Nick, thank you very much. To Adam Hale of PA.
Prif Weinidog, you've today announced that international travellers will have to take a pre-travel coronavirus test before their journey to Wales from Monday because of concerns about the variant strain of the virus. People perhaps be asking why it's taken you so long to introduce this, given we're 10 months into a global pandemic.
Well, I think the first thing to say is that we are doing it because we are part of the UK-wide move to do this. We don't have responsibilities in the Welsh Government for foreign affairs and for border security. It wouldn't be possible for us easily to do this entirely on our own. All four nations of the United Kingdom have acted always together on this matter because so much of what you need to make it effective is in the hands of the UK Government with their responsibilities. We have announced it now rather than a week or so ago because there are actually no flights into Wales at the moment that would be affected by this decision. And nobody who comes in through our ports from Ireland are affected by it in any case because this doesn't apply to people in what is called the common travel area. The first flights we are expecting into Cardiff Airport will be at the start of next month. So we're now putting everything in its place. So when that happens, then anybody coming in to Wales will have had a pre-departure test. But there's no delay because we haven't had anybody coming in that way in recent weeks.
Thank you. And on the new rules for supermarkets, the contact tracers that in place here in Wales, have they been seeing large amounts of people testing positive who are our customers or who work in supermarkets?
I think they see both. And the patterns change as lockdowns are introduced because when people are able to meet in many places, then the rise in the number of cases has been driven more by the way the people behave at home. Now that people aren't able to meet within their own homes, the pattern changes, and it's why we are focused today on workplaces, because that is where people can still meet, and we're still seeing numbers increasing in some workplaces, and supermarkets is one of the other few places where people can end up with other people around as well. So the patterns detected by our TTP teams depend upon the different ways in which people are able to behave in the community depending on the rules of the time. They certainly detect both visitors, shoppers and members of staff who find themselves positive for the virus, and where it is likely that that would have been contracted in supermarkets. Supermarkets are safe places. Right? You know, I don't anybody want to get the idea that supermarkets are dangerous places. Supermarkets are safe places, and we're incredibly grateful to all those brave members of staff who have been in there providing face-to-face services to members of the public since the very beginning of the pandemic. We want to make sure that they are even safer by putting all the measures that were previously visibly in place here in Wales. Diolch, Adam, drosodd i Thomas Evans.
Diolch, Prif Weinidog, prynawn da. Ni wedi siarad gyda Bernard a Barbara, ddau ohonyn nhw dros 80, a maen nhw'n awyddus iawn i gael eu brechu yn erbyn Covid-19. Mae'r ddau'n dweud wrtho i y bydden nhw'n hapus i gael eu brechu unrhyw awr o'r dydd. Felly, ydy canolfannau brechu 24 awr, 7 diwrnod yr wythnos rhywbeth sydd o dan ystyriaeth gan Llywodraeth Cymru, ac os felly pryd a ble fydd y canolfannau yma yn cael eu sefydlu?
Wel, wrth gwrs ni ddim wedi dweud o gwbl dyn ni ddim yn ystyried hwnna, ond ar hyn o bryd, be ni'n eisiau wneud i roi cyfleon i bobl i ddod lan i cael ei frechu mewn lle ac ar orau sy'n gyfleus iddyn nhw. Dwi'n siŵr bydd rai bobl yn fodlon i troi lan dros nos, ond ni'n siarad am bobl sy'n fregus, ni'n siarad am bobl sy'n hen oed, ni'n siarad am bobl sy'n byw mewn cartrefi preswyl, ac ar hyn o bryd, dyn ni ddim yn feddwl bydd ni'n defnyddio'r adnoddau sydd da ni mewn ffordd fwy effeithiol i agor canolfannau dros nos pan ni'n gallu defnyddio'r y brechlyn sydd da ni yn ystod y dydd. So Thomas was asking me whether we had plans to open vaccination centres 24 hours a day, and was giving me some examples of people who said they'd be happy to attend them outside daytime hours. And I was simply explaining that in these early stages, when we are focusing on people who are getting on in age, who are physically vulnerable, who live in care homes, then we're trying to offer the vaccine at times of the day and in places that are convenient for them and match those needs. In the future, as we move into further age groups and the pattern of supply of the vaccine increases, we haven't closed our minds to doing things on a round-the-clock basis where that would be necessary. But at the moment, it wouldn't be the most effective way of using the supply of vaccine we have, the supply of workers that we have to deliver it, and the nature of the population that we are serving.
Diolch am hynny. Dros gyfnod o 2 ddiwrnod yr wythnos hon, nath tua 200 o bobl fethu eu hapwyntiadau brechu yn y ganolfan frechu fawr yn ysbyty enfys Bangor. Mae Bwrdd Iechyd Betsi Cydwalydr yn pwysleisio'r pwysigrwydd bod pobl yn gwneud pob ymdrech i gadw at eu hapwyntiadau brechu. Ydych chi'n tegu'r neges hon?
Wrth gwrs, mae yn pwysig pan mae bobl yn cael galwad ffôn neu llythyr sy'n wahodd iddyn nhw i cael y brechlyn, mae'n hollol bwysig i bobl i troi lan neu jyst i esbonio pan maen nhw ddim yn gallu. Os maen nhw ddim yn gallu, os maen nhw ddim yn gyfleus neu mae rhywbeth arall yn mynd ymlaen, wrth gwrs mae Bwrdd Iechyd yn fodlon i roi fwy nag un cyfle. Ond jyst i ffeili troi lan, beth mae hwnna'n golygu yw dyn ni ddim yn gallu rhoi gwahyddiad i rywun arall, i llenwi'r bwlch na. So mae yn pwysig, a dwi'n cytuno'n llwyr gyda beth mae Betsi Cydwalydr wedi ddweud i ofyn i bobl i troi lan neu rhoi galwad ffôn i esbonio dydyn nhw ddim yn gallu wneud e. Thomas pointing out the number of appointments that were offered in a centre in Bangor that weren't taken up by people. Betsy Cadwallader, the health board, which has vaccinated the highest number of any health board in Wales, asking people to make every effort to turn up to appointments when they are offered. And I was simply saying that I absolutely endorse that. If there's a good reason why someone isn't able to attend, then please just let the centre know, and then they'll be able to offer the appointment to somebody else, and there'll be another appointment offered to the person who wasn't able to attend for the appointment in the first place. But if people just don't turn up and they don't let us know, then that's a missed opportunity for somebody else. So a plea to people, when you get a phone call or you get a letter, make every effort to attend, or let the centre know that you're not going to be able to do so that that spot can be filled by somebody else. Thomas, diolch yn fawr. Over to Dan Bevan at LBC.
Thank you, First Minister. Good afternoon. Your announcement today on supermarkets is rather vague for the people who actually need to follow the rules, the customers. You're asking workplaces to complete risk assessments, but that's for things that they should already be doing in the guidelines. What people want to know is, do they have to sanitise their hands and trolleys before they go into supermarkets? Do they have to follow one-way systems? How is this going to change the experience for consumers?
Well, I think it will certainly change the experience for consumers in those settings which aren't already doing these things. So you will remember, Dan, I'm sure, going to a supermarket back in April or May of last year, there was always somebody at the door. There was always somebody checking the number of people going in and out. There was always somebody there pointing you to where the hand sanitising material was available when you went in. There were markings on the floor to help you to get round the store safely. There were announcements on the tannoy reminding people how they should behave. Now, all of that has been in the guidance, and the majority of supermarkets have stuck with it. But there is evidence, and it's certainly the evidence of the people who contact me, that those are not there everywhere in the visible way they were before. Supermarkets, we know, want to make every effort to make sure that their staff and their customers feel safe. And putting these things into the regulations, as we will do next week, just strengthens that, and I think will give everybody greater degrees of confidence that when you go out shopping, everything is being done that can be done to keep you and others safe.
Thank you. And on the easing of lockdown, or any potential easing, and going into alert level 3, there are a number of things in your own guidelines that say that we need to be hitting, including, for example, 300 cases per 100,000 people. We're at 365. The R number needs to be below 1. We're at between 0.8 and 1.1. Hospital capacity, the concerns of that needs to be 5 weeks away. We're currently under very extreme pressure at the moment in Wales. And also positivity rate needs to be around 5%. We're at 4 times that here. We're a long way off any sort of easing for lockdown, aren't we, First Minister?
Well, we're not a long way off on some of those measures. You know, this time last week, the rate per 100,000 was well above 400, and now it's down to 365, and we're talking about 2 weeks away before we review the regulation. So, you know, we are definitely seeing progress being made, but some of those figures will not move as quickly. We certainly won't see reductions in hospital occupation moving as fast as the community falls, because we know there's always a delay. But the other thing I think it's important to remember, Dan, is that, you know, even within levels, it is possible to make some adjustments. So even if you're not able to go from level 4 to level 3, within level 4, it may be possible, and it's a may. I really want to stress that it is a may. There may be possible to have some marginal easements that would demonstrate to people that the efforts that they are making a difference. Dan, thanks very much. Over to Abby Whitewick at Wales Online.
Good afternoon, First Minister. You've just said that supermarkets are safe, yet you've also said that they are a place of transmission as well. And obviously it will depend on the supermarket. You've introduced these new laws. The managers will be responsible. Why were these restrictions not made law months ago?
Well, I mean, just to be clear with everybody, anywhere where people meet, there is the increased risk of transmission. So even when places are doing everything they can, when there is a level of transmission in the community of the sort we have seen in Wales, this virus will find a way of getting in there, and some people will find themselves affected, and that is true of supermarkets as it would be of anywhere else. We've had these obligations in the guidance in Wales since the very beginning. What I am responding to is the visible sense that there is in many communities in Wales that the things that they saw earlier in the pandemic are not as visible to them as they used to be, and that has an undermining effect on their confidence. They're not sure that those places are doing everything that they could be. And some of this is just about making all that visible again to people so that people can see everything that is being done to keep them safe and to give them the necessary confidence then to be able to use places which are, after all, pretty vital to most of us to keep our lives going, even in a lockdown.
So obviously shopping is vital, but again, it is one of those few places that people do gather and may pass on the virus. Would you suggest that people should think of shopping less? Would now be a time to have some guidance on perhaps people should only go shopping a certain number of times a week for food? Is there mileage there, given that this is now one of the only places where people are meeting like that?
Well, I think you make a good point. Certainly, this is one of the few places where people still meet. And in fact, in our guidance to shielded people, we've made the point in the past that people who feel able to go shopping may want to think about going at a time of day when there will be fewer people around. And I think the points you make are sensible ones that people will want to reflect on in their own lives. Our advice from the Welsh Government is meet as few other people as you can on as few occasions as you can, and that it's sensible to think about shopping in the same way. Thanks very much for that, Harry. To Mark Hutchins at 5 Live.
Thank you, First Minister. The Northern Ireland stands out as being the one part of the UK that is not only meeting its vaccine rollout targets, but exceeding them, particularly over care homes. I think they've now visited more than 95% of care homes. Do you know the figure for Wales, and what are the lessons that Wales could and should learn from Northern Ireland?
I think it's a bit early to be definitive about learning lessons, but if I had to draw one tentative one from the first couple of weeks, it is, I think you will find that they have had a larger volume of supply of the Oxford vaccine. So obviously the population of Northern Ireland is significantly less than Wales, but they've had more of the Oxford vaccine available to them than we have at this early stage. And that will even itself out over the weeks ahead. But if you've got more of the Oxford vaccine for fewer people, then in a percentage sense, you are going to get around more of them because the Oxford vaccine is more easily deployed in care homes, and the Pfizer vaccine, which, as we all know, is kept under has to be kept under very particular conditions. So I suspect it'll just be something as practical as that in the early weeks they've had some opportunities that haven't been here in Wales in the same way, and that will even itself out over the weeks ahead.
And as far as lifting the lockdown at some future date is concerned, I know there are various criteria. Do they include vaccinations? How far do we need to get down that vaccination list in order for lockdown to be lifted in any meaningful sense?
Well, vaccination will play its part in the calculations that we will all make as to what activities can be returned to people. I think there are some challenging conversations that we will end up having to have over the months ahead about what exactly having a vaccine means in terms of what freedoms it restores to you. I sometimes fear that the understandable enthusiasm that there is about vaccination and the way it's talked about in newspapers, for example, may lead some people to think that so long as you've got a vaccine, you don't need to take any precautions in the future. And that won't be the case. People who are vaccinated will still have to play their part in sustaining the other measures that we are all asked to take while this virus is still at large in our communities. At the moment, we are rightly focused on getting as many people vaccinated as fast and as safely as we can. When it comes to lifting measures, then simply having the vaccine by itself will not be sufficient to return life to as it once was. And we're going to be living with the other restrictions, the social distancing, the being careful, the washing of hands. That's going to be with us well into this calendar year alongside the vaccine. I think I'm going next to Tom Magner at Carers World.
Yeah, thank you very much indeed, First Minister. The vaccine priorities have been causing considerable difficulties amongst our viewers. On the 30th of December, the JCVI updated their advice to include unpaid carers in priority band 6. Footnote 3 to band 6 said, this includes those who are in receipt of a carer's allowance or those who are the main carers of an elderly or disabled person whose welfare may be at risk if the carer falls ill. Now, it was only yesterday evening that your colleague, the Health Minister, confirmed in a tweet that unpaid carers are in priority band 6. But this critical footnote 3 to the JCVI advice was not included when the 7 health boards sent out their vaccination letters across Wales. We've seen the example of Swansea University Health Board. So the information, it appears, was given to the medical teams and was out of date. We've had hundreds of viewers contacting us asking for an assurance that future JCVI priority changes will be communicated without delay. But above all, it gives rise to the pressing question in the mind of every unpaid carer. How do I make sure that the medical teams know that I'm an unpaid carer when it comes to prioritising my appointment and that I'm not left out?
Well, I think the answer to your question, Tom, I hope, apologies if I'm not following it completely. I think the answer to your question is that the footnote to the JCVI advice is the way in which an unpaid carer would make it known to a vaccination team that they are covered by it. And I know it sounds terribly bureaucratic and difficult, but you can imagine that you could not have a system in which simple self-certification would be enough to move you up a prioritisation list. That there has to be some way of knowing that if someone says they are an unpaid carer, that you know that that is a truthful reflection of their circumstances. And that's why the JCVI footnote will be there to allow that to happen. And provided an unpaid carer is able to demonstrate, and those didn't sound that difficult to me to be able to demonstrate, because there will be, letters from the DWP and so on confirming those awards, then people will know that they will be able to provide that evidence and put themselves into that priority category. I will say this, that I know that the JCVI continues to look all the time at its advice and at its categorisations. And if this particular footnote is causing difficulties or concerns to people, I'm sure they'll be willing to try and look at it and provide additional confirmation or clarity if that is helpful.
Thank you for that. You seem to be saying that unpaid carers have to prove themselves that they're unpaid carers rather than the system itself recognising that they're unpaid carers. And doesn't this really go back to the fundamental point about the Social Services Wellbeing Wales Act and the virtual lack of understanding and knowledge amongst the people of Wales from the Carers Wales survey that was conducted in the autumn?
Well, I don't honestly think it is any different that if someone in the top priority groups is a healthcare worker, if you turn up for a vaccination on the basis that you are a healthcare worker, you have to be able to demonstrate that you are a healthcare worker. The system has to have some sort of check in it that someone is who they say they are. And we want, of course, we want unpaid carers to get the vaccination and the help that they need and absolutely merit through the work that they do. But I do think that all the JCVI footnote is trying to do is trying to find some way of passporting that person into the system in a way that offers confidence that the person is who they say they are and are doing what they say they are doing. And unpaid carers in that way are being treated no differently to any other category where people have to be able to show that they are genuinely within the category that is being given priority. Otherwise, anybody could claim to be a social care worker, for example, and get themselves to the front of the queue. There has to be some sense of fairness in the system, and checks and balances is the way that fairness is secured, and we certainly want fairness for our unpaid carers. Tom, thank you. I'm going to Steve Bagnall at the Daily Post.
Thank you, First Minister. You've mentioned the situation in Wrexham and Flintshire still remains serious, where other areas are seeing reduced rates. Do you have any information why rates remain high there? And would the Welsh Government consider extra measures or interventions across the two counties?
Steve, thank you. Well, pleased to say that we have seen falls in the positivity rate in Flintshire and in Wrexham in the latest figures. So there are signs that the improvement in North Wales is applying in North East Wales as well as further west. The reasons for it? Well, I think we can be certain of some and a bit more speculative of others. I think we can be certain that the fact that the new variant of the disease has established itself in North Wales to such an extent is driving up the numbers because it is so much more contagious and so many more people fall ill quickly with it. And I think the permeability of the border between North East Wales and North West England is bound to be having an impact as well. And in Liverpool today, for example, the rates are over 1,000 per 100,000, and rates in the northwest of England, I think I'm right, are rising faster than any other part of England. And when you have a population that lives so close to one another and where people cross that border every day for legitimate reasons, then I think it's not, not an unfair speculation to suggest that that's probably having a greater effect in that Flintshire and Wrexham area than it is further west in Gwynedd or Ynys Môn.
Thank you, First Minister. There have been reports of supermarkets being used in parts of England as vaccination centres. Is that something that's been considered for Wales?
I don't believe we've got any supermarkets at the moment, but of course we have community pharmacy operating in supermarkets in many parts of Wales. So part of our conversation about using pharmacy facilities will include those pharmacists that are in supermarket settings. When we get to 45 mass vaccination centres in Wales, and as I say, we're getting there faster than we had expected and with more centres than we had originally planned, we will actually have a higher number of centres per head of the population than any other part of the United Kingdom. And it may be that we will have a more effective and quicker use of the vaccine by concentrating on those than having a great multiplicity of centres all only able to do a relatively small number. But that certainly doesn't rule out supermarkets where there are community pharmacy operations going on there. Steve, thank you very much. Over to Rob Taylor at Wrexham.com.
Good afternoon. Previously, you've said reputation should be incentive enough for supermarkets to follow the regulations and guidance, but clearly that's not been the case if things are moving in the law. How will the new regulations specifically strengthen enforcement against supermarkets, as you can't close them as they're essential, and the current level of penalties in the regulations is effectively a rounding error in terms of turnover?
I do think that supermarkets are very unhappy when enforcement action is taken. And we know that in some parts of Wales, local authorities have made a particular effort to make sure that environmental health officers visit, advise, and where necessary, take action. And actually, reputation does really matter to supermarket chains. They definitely don't like it or wouldn't want it when one of their supermarkets becomes known locally as somewhere that was regarded as falling below the standards that an environmental health officer would require. So, peer pressure between supermarkets to make sure yours isn't the one that is highlighted in that way, and the wish of the sector to do the right thing by their staff and their customers, I think is more effective than financial penalties, which are there and have been applied to supermarkets, but I think are less worrying to the supermarket than those reputational issues that matter to them.
Thank you. And is it possible to get some clarity on the vaccine figures and supply? 300,000 vaccine doses have reportedly been delivered to Wales and around 125,000 have been given out. Is that 300,000 figure accurate? And if so, where's the bottleneck to get them off the shelf and effectively into people? Is it the throughput of the vaccination centres, or is there a throttling of supply taking place so Wales does not run out of supply?
The figure is broadly correct. It's made up of around, in very broad terms, completely accurate now, 50,000 of the Oxford vaccine and 250,000 of the Pfizer vaccine. We will have been using all the Oxford vaccine that we get as we get it. The Pfizer vaccine has to last us into the first week of February. So we have to provide it, on a week-by-week basis. What you can't do is to try and stand up a system which uses all the vaccine you've got in week 1 and then there's nothing to offer for the next 4 weeks. So we won't get another delivery of the Pfizer vaccine until the very end of January or maybe the beginning of February. So that 250,000 doses has got to last us 6 weeks. And that's why you haven't seen it all used in week 1. It's because we've got to space it out over the weeks that it's got to cover. We are expecting a significant upswing in the Oxford vaccine coming to Wales next week. And we will use all of that because it is a much easier vaccine to use and can be used in GP practices and so on. We will continue to use the Pfizer vaccine in a way that will mean that we will use it all before we get the next delivery. Rob, thank you. Over to Alan Evans at Cynhadledd Online.
Thank you, First Minister. Glimmers of hope. What a wonderful St. David's Day it would be if we could all raise our heads like the daffodils and go out and greet the world again. I'm sure the First Minister is aware of the continued fears amongst rural Welsh communities over this closure of small schools, not least because of the fear of the impact it will have on the Welsh language. We've been contacted by some of these families whose lives have already been turned upside down by COVID-19. The consultations are going ahead. Some families may not have time, confidence, or the technology to join the Zoom meetings. Would the First Minister concede that given the circumstances, the consultations should be placed on hold until such time as parents can meet, review and discuss plans with local authorities face to face?
Alan, thank you very much, Diolch yn fawr. I know that you raised previously with me the school in Mynydd y Garreg, and the Welsh Government has changed the rules in relation to the closure of small rural schools. So the presumption in the law now is that it won't close. Now, it doesn't mean that it can't close because sometimes the local authority is able to make a compelling case. But the presumption is that it'll stay open and it's for the local authority to prove that shouldn't be the case. I do understand the points that you make, of course, about the extraordinary circumstances in which consultation and discussion with parents has to take place during coronavirus. And I'm happy to write to the local authority in Carmarthenshire to just put it to them and to check with them that they are carrying out the statutory duties that they have to have those consultations in a way that takes account of the extraordinary circumstances in which parents and the local authority itself will be operating.
Back to COVID now. We received a call from Mrs. Teresa Bowen in Llanelli, who said that she, like many, is in a lottery regarding when she will get a vaccination, despite being on oxygen and already suffering asthma. You'll be aware Dr. Hickman of Llanelli, a GP, took to the media this week to highlight the way in which some surgeries may receive the vaccine much later than others, despite having large numbers of patients in the high priority group. I won't go on about what Dr. Hickman said, but you spoke about supply last week. Could these high priority patients expect a vaccine before those, say, in a surgery that may not have large numbers in that group? Surely the Health Board's records would be the first place to start making lists for prioritising. Is that something being used at present to determine priority?
Well, I'm very pleased to say that I think every GP surgery in the Hywel Dda area has volunteered to be part of their vaccination effort, that there are more and more of them being brought on stream week by week. It is a matter of the supply of the vaccine. Every bit of the Oxford vaccine that goes to Hywel Dda is being used, I know, and it is all going to the highest priority groups. And I know that vaccination is taking place in GP surgeries in Carmarthenshire, because my mother, at the age of 90, had her vaccination yesterday in a GP surgery in Carmarthen. And if the practice in Llanelli has not yet had its supply of vaccine, I know that the Health Board has plans to make sure that that happens as fast as possible, because it, like every Health Board in Wales, wants to make sure that we get to as many of those vulnerable people as fast as we can. It is going to take a small number of weeks. We can't do everybody in week one, but the Health Board will have heard what has been said about the practice in Llanelli, and I know will be doing everything it can to make sure that it is part of the huge vaccination effort that primary care in that part of Wales has signed up to deliver.
Diolch.
Alan, diolch yn fawr iawn. Thank you all very much indeed.